Right, I've now pressed record. So, good morning, everyone. Welcome to, or good afternoon, as I think it now is here in the UK. Yes, 12:37. Welcome to the first session on the expert stage of the Hack From Home against Covid-19 Hackathon that we've been hosting here in the Hack Lab and the ETA. I'm welcoming here Thomas Landrain from Just One Giant Lab, who's going to be talking to us about research collaboration in the time of Covid-19, particularly the initiative that Just One Giant Lab, or JOGL, as it's called acronym-wise, have been leading on. I think for us, this is one of the things that really excited us when we were beginning to develop this hackathon and contemplating the further initiatives that we're going to be launching out of this. It's this incredible spirit of collaboration and energy that we've been seeing amongst the technical and research worlds, communities right the way around the world. All these people coming together, contributing time, resources, experience to trying to make a difference, both as ever to the spread of the pandemic, but also, again, to its social effects. Core to this for many people has been the open ethos of actually, opening up your IP. I think that's a very powerful thing. So, Thomas, without any further ado, I shall allow you to chat to us a bit about your work and your vision.
Yeah, thank you so much, James, for inviting me. Hi, everyone. I'm very pleased to be part of this unique initiative, this online hackathon. As James said, I'm the co-founder and CEO of Just One Giant Lab, which is a nonprofit organization based in Paris. We mostly work around an open source platform called Joggle.io, whose main mission is to bring together project leaders that are doing scientific and technological projects for the greater good with volunteering contributors. Our vision is that there are a lot of problems out there that cannot be solved using traditional institutional approaches, such as the academic one or even the corporate one. Mostly because sometimes most of the problems don't have any business model, and when you're on the academic institution side, things tend to take a lot of time to activate. So the point here is that we want to enable people that would like to contribute to join not only citizen science project, but actual scientific projects, where you have an expertise. You could be also yourself, a scientist, or you could be an engineer, you could be a designer, you could be a project manager, you could, or community manager. You could actually use your skill to enable scientific and technical project to advance. And so we launched the platform very recently, about 8 months ago now, and it's still in beta, even though it's stable. And the goal is that we provide the platform for free. The platform itself is fully open source, and so you can go there, create a profile, create your own project, join groups, etc. And the other thing we do is we create research programs ourselves. We partner with organizations, and we define a problematic, and we come and accelerate the community around those specific goals. And that's exactly what happened with the COVID-19 crisis. We identified this crisis early on. Myself, as a biologist, I could read the numbers, and it was clear that the wave were going to hit us very hard, and the institutions that were going to be totally overwhelmed. Back in the days, I also created one of the very first biohacker spaces in the world called La Paillasse in Paris. And one of the projects I did there was to hack a DNA barcoding, like a genetic diagnosis test, if you want, to enable anyone to test what species they have in their garden, or to know just what kind of species they have in their plates, for food. And I saw that if we could do that at the time, creating what we call the quick and dirty DNA barcoding, why actually we couldn't make a cheap open source diagnosis test for coronavirus? And I was not seeing any obstacles, if you want. So I started to contact my own communities. Okay, would you be interested in doing this? I was getting actually positive responses, and so okay, let's actually use Joggle as it was meant to do that. I started a project specifically on diagnosis tests. This was remember, this was in the end of February. At the time, people were not yet like dying in Europe as we are right now. And so what was the main issue was the lack of tests. And just because we didn't know what status our population were at, what status the pandemic was at. And so very fast, in a matter of 2 weeks only, we mobilized more than 1,000 people. And now after months, we have more than 3,000 persons that joined the initiative. And so obviously we grew out of the specific diagnosis test project. And now we have more than 60 projects. We have now a full open COVID-19 initiative program, which is here that you can join on Joggle. To give you a few examples of projects, it's really large. Maybe I should show you actually the challenges we have. We have 3 main challenges. One is about treatment, the other one is about diagnostics, and then the prevention one. We just launched a new challenge, which is called validation. This is in partnership with APHP. APHP is the Paris Hospitals Association, and they help us evaluate and validate open source solutions for, well, if for example, mask, syringe pumps, ventilators, etc. This is very important because no one wants to use anything on patients that has not been validated. So you need authorities for that. To give you some example of projects, so it's maybe let's go to the newest ones. Here, for example, just recently we launched a project to adapt the design of an open source syringe pump to hospital uses. Hospitals right now are lacking syringe pumps that are used for doing intravenous injection, and so mostly for food, sometimes for drugs, and also in more specific cases for anesthetic drugs. And this piece is missing right now. And so PHP told us that they need some, and then they don't have the time. Like the industry don't have the time to produce them. And so we have to come up with a solution very fast that could be manufactured, for example, in maker spaces. And so it's very diverse. I would say, like we even have like projects for education. Here, for example, we also have a project specifically to do enzyme production. So if you come to a diagnosis test, what you need is reagents, and especially you need to test for the presence of the coronavirus. You can do that in different ways. Either you use antibodies, and then you actually, it's basically how pregnancy tests are working. But most of the time, the easiest way is to use genetic amplification. And usually you use PCR for that. And genetic amplification requires enzymes. So, and enzymes are not always, out there, on your bench. So, and they're starting to lack as others are climbing up. So another way to do it is to produce those enzymes yourself. And so here is a project to do that. We are partnering also with the Free organization in California, and the Open Bioeconomy Lab, who's working on setups for self bioproduction of enzymes, and making all those open source, so that anyone in the world could produce their own enzymes to manufacture their own test. So we have also a lot of applications. For example, even people working on just statistical application of data science to understand how the pandemic is evolving. So maybe what I can do is one of the latest project that we launched is this open source face mask challenge. And in this project, it's kind of like a meta project. The goal was to gather all existing open source face mask designs. In a matter of 2 weeks, we gathered more than 70 designs for not only face masks, but also face shields. And some of them right now are being printed and being tested out in APHP. And so we should be able to come back next week with actual results about what is working, what is not working. And it's not only about filtering efficiency, it's really about comfort. As we have feedbacks from nurses and medical doctors saying that when they wear masks on the long term, they're starting to have scars forming on their face. And so we have to avoid that. So, and then another project, for example, is this one. It's an app that uses AI to hear your cough and see if your cough is an indication of if you're COVID positive or not. As the way the infection works in your lung, the sound that you will be producing could be slightly different, but significantly different, so that maybe you can actually detect that. So there's a team working on this app, and specifically. You can join all those projects pretty easily. Here is a project for a crisis emergency ventilator also. And it's, maybe I can show you more about, let's see. Here, for example, is another database project. They're using wearables like a smartwatch or a smart balance to look at data, personal data that could be also indicating if you're potentially becoming COVID positive. And so it's a very participatory project where patients themselves are volunteering to share the data. And it's a project that is being done in partnership with the Open Humans Foundation. And
the Open Humans Foundation.
That's right.
Thomas, you have to, Thomas, you'll have to send me some of these links afterwards, because this is incredibly interesting.
yeah, this is fabulous. We have about, we have so many projects that I actually don't know all of them, because every day some new ones appear. And so the way it works is anyone can create a project. They can, if I go there, anyone can create the needs, share like specific needs, and people can react to those needs specifically. So it facilitates the connections between volunteers and the project leaders. That's very nice, I would say. You can share some updates about what's going on, what you need, and people can just follow the projects. And then when they go back to their main page, it's very Facebook-like here. There you get like a feed, like on Facebook, about everything that is going on, the project that you're following or the people that you're following. So it's very practical to somehow be part of a larger community and stay up to date. Here are the latest needs that were posted. And so the other things we do is since this week only, thanks to a big partnership with the AXA Research Fund, we are now proposing grants to projects. So projects can apply to get grants, and not only grant, but to get reviewed also by a community and experts. And we provide what we call micro grants up to 3,000 euros per project. So that it makes it just easier for promising projects to get started and get a working prototype. And projects can apply at every round. So if they actually use all the money and have good results, they can apply again, basically. So we did that mostly because a lot of the projects on the Juggle platform are not being hosted by actual institutions. So they don't have access to typical money, or even if researchers are doing, for example, some of the project there, it's not a project they're doing through their own institution, through their own lab. They're doing at a personal level. So they cannot ask money from their own institution to fund the projects. So this is where basically where we enter. So yeah, that's pretty much it. I don't know if questions are possible. How do you want to do that, James?
Have myself taken on mute there. Yeah, well, firstly, thank you so much for that talk. That was really interesting to hear how Joggle is has this COVID initiative and some of the really interesting set of projects you guys have. Guys, if you have any questions, please do feel free to put them into the Q&A section, and you can ask away there. As Thomas highlighted, there is a grant scheme that they have, and those who have done well in the hackathon this weekend, as assessed by our judges, will have access to those grants through Joggle, which is a really exciting opportunity to get yourself a bit of money to carry on working on your project and doing some good, as well as being connected to a really interesting research community. How many projects would you say you now have on there related to COVID?
Last time I counted was about 60, I'd say.
60, interesting. What country was that that device one based, as the flu monitoring device? It's quite interesting, that one.
So everything is all projects are now international, and as it cannot be seen as the project being done only by the few leaders.
Yes.
Yeah, I wanted to show you those maps, and so those are not actually it's from last week, but it's here we have all the countries, for example, where we have Joggle participants. We are almost from every country in the world, and here's the skill map on Joggle, and we clearly see, for example, here you have biology, here you have data science and coding, more about open science in general, here about project management, communication, design, here, etc. So it's very diverse, and so the AI cuff is let's go. Let's have a look to this one specifically. All right. So here. How did they put it in prevention? Okay, they didn't register yet to a challenge. So let's go there. Yeah, here. So here what you can do is click here. And here you have the different people working on the project. So you can have a look where they're at. The leader, Hanan, he's based in Argentina. And he's a bioinformatics developer. And yeah, what I like is, so here is a French person. He's from, I know this guy is from Ireland. It's very yeah, I don't know. It's very diverse. And so that's what's interesting here is that you can be anywhere in the world. If you find this project interesting, because they are on Joggle, it means that they're open for collaboration. So you can just join them.
So we've had a question, I think, regarding how international it is. Firstly, someone's wanting to know, well, how we get in touch, list our projects. So I guess I can answer that in a sense. So for projects that have come through this hackathon, they'll go through us. So our judges will assess it, and then we'll pass that on to Thomas and say, these won, and then they'll get access to the fund. Though, Thomas, there were some conditions around it being open, which perhaps you might like to speak to.
Yeah, absolutely. So one of the big pillar of Drogo is its open source philosophy. So the requirement to benefit from Drogo in its community is that the product of this collaboration has to be open source. And so it's very important for us, as the main goal of our NGO is to facilitate the creation of open source, like open knowledge and open source tools that could be used anywhere in the world. And so you're absolutely welcome to come and apply to the grant yourself. You just have to follow the templates and the guidelines when you come to the Drogo platform. And as James said, so we'll be listening also to what the judges of the hackathon we said, and we'll be also providing grants to some of the best projects of these hackathons, of this hackathon. But if you're, even though you're, you may be not, in this panel list for some reasons, at the end of this hackathon, you can still continue working on it and come apply to the grants on Drogo. So don't hesitate to do that. Yeah.
Great. Well, I mean, that's been really interesting. Are there any other questions that we have? Oh, yeah, someone was asking, I guess broadly, if someone goes through Joggle, what about local laws? Does the project help connect them to, local, for instance, say people who need to provide information on local data protection law? Will that be something that the project does?
So we can provide counseling as we have experts from almost all disciplines. So it's I would say not hard to find a person that can provide you answers to your questions. In terms of validation, in terms of is that all right? Does that work? We don't do that, but we can it's if, for example, if it's in terms of GDPR, you can find lawyers in the Drogo platform, and you can ask those questions. If not, if you don't find the right person, we can find some people for you. And the goal is that we grow this platform as much as possible in its community, so that it will become easier and easier to find those kind of skills.
Fantastic, fantastic. So I'll ask one question. What single project are you most excited by on Joggle? Wow,
there are many projects, and some of them are more short term, some others are more long term. Right now, I'm really being excited by this collaboration we have with APHP, as it provides a unique opportunity to validate open source designs made by the community. And I think it's fantastic to see this kind of collaboration happen. What I'm being excited also by is, so many projects are exciting. But what I see is we're mostly use of open collaboration in the digital industry, in the digital world, so seeing apps and data science collaboration is not new, even though it's so impactful. And so I'm really happy to see this is continuing in the COVID-19 crisis, but seeing this happening in the biotech world, which is much more rare. And I see this is being a new trend. As biotech is becoming easier and easier to prototype, and so we're not yet at the point where it's as easy to prototype as a software, but it's getting closer. And so having access to the right consumables, regions, equipments at a low cost is not an issue anymore. And you have more and more open laboratories around the world. For example, in the UK, you have in England, you have, in London, you have OpenCell, you have the London Biohackerspace, you have, for example, in Manchester, you have MadLab.
Yes, yes.
And so So you can go there and even actually, if you have an idea, test it out. So that's very powerful, and so I'm seeing a big trend here as biotech has a lot of power. It can do things that are incredible in terms of health applications and environmental monitoring. And so if we can actually bring out tools that are cheap and could be prototyped and applied to different localities, I mean, we will gain so much out of this. And so that's why I'm really enthusiastic by the groups working on the diagnostic tests here and technologies, because it could be open source. It means that if it works for the coronavirus, it will be working for almost any other kind of pathologies, of sickness, basically.
Fantastic. Well, thank you so much for chatting. I'm aware that we're now slightly over time, although we did start a couple of minutes after. I'm sure various people will have a lot more questions to ask you. If you have any time free, it'd be fantastic, maybe to join the Ask Me Anything channel on Slack for a few minutes, if you have a moment.
Yeah, sure.
I sent you the Slack link, I believe. So yeah, if you pop into the Ask Me Anything channel, then yeah, you can fire away there. I'm sure there'll be plenty of people wanting to ask more about the projects and maybe for how they can continue.
Where do I go? It's on the Slack, you said?
Yes. So I send you a Slack link, I think, over email.
Okay, perfect.
And if I did not, then I will make sure that that is sent. Yeah, awesome. We'll take it from there.
Great.
All right. Well, look, thank you so much, Thomas. That was a really interesting talk. I think it's really central to the ethos of what we've been trying to do from Hack From Home as part of this, global movement of people trying to come together to fight COVID-19 and collaborate on research and applications. And of all the initiatives that I've seen, yours, in a sense, to my mind, really kind of highlights the opportunity of what people can do to make a difference at this moment in time through remote collaboration. So it's been really great hearing about it over the last couple of weeks as we've chatted, and then today in this particular conversation. So thanks very much.
Thank you to you, and good luck to all the participants.
Thank you. Cool.